Joining us once again to provide interpretation is Margie Prop. Thank you, Margie, for your services. And thank you to all of you for tuning in to learn more about the latest local developments, how to keep yourself and your loved ones safe, and how to help end this pandemic. The Lincoln-Lancaster County Health Department has been a leader in the state in our preventive efforts and our approach to large-scale vaccination clinics. We undertake this work recognizing how vital vaccines are to public health. Vaccines provide protection against the virus for our families. They prevent illness, and they save lives. Initial data indicates that the vaccine also offers some degree of protection against COVID-19 variants. So having more people vaccinated puts us in a better position to prevent not only the spread of COVID-19, but the emergence of new variants in our state and our community. We continue to make great progress in these local vaccination efforts. To date, over 109,000 residents have received at least one dose of vaccine, and 59,000 residents of Lancaster County are fully vaccinated, about 1/4 of our adult population. We are fortunate to have such high demand in our community, and we are moving through the age and demographic groups as quickly, efficiently, and equitably as possible with the vaccine supply allotted to us. The U.S. currently utilizes 3 different safe and effective COVID-19 vaccines, and we encourage people locally to get the first vaccine that's available to them. To get notified when it's your turn to be vaccinated, please register with our local health department by going to lincoln.ne.gov and clicking on the COVID-19 vaccine registration link at the top of the page. It's very important right now that community members ages 16 and older get registered soon. Now, before I turn this over to Health Director Pat Lopez, we do want to take a few minutes to celebrate. Today, it is National Doctor's Day. A physician's wife created this tradition back in 1933, and this is the 30th anniversary of the day being officially designated as a national holiday by Congress. This proclamation reads in part, whereas the city joins Lancaster County Medical Society and the Lincoln-Lancaster County Health Department in thanking our local physicians for choosing a challenging and noble profession and for their dedication to healing others and saving lives. And whereas our doctors and other medical professionals have been on the front lines during the COVID-19 pandemic, risking their own health to care for others and working with public health agencies to prevent the spread of the virus, and now to administer life-saving vaccines. Now, therefore, I, Lyrian Gaylor Baird, Mayor of the City of Lincoln, Nebraska, do hereby proclaim March 30th, 2021 as Doctor's Day in our community, and I encourage all residents to honor their extraordinary service to our city, state, and nation. And joining us now by Zoom is one of our honorees, Dr. Eric Avery, President of the Lancaster County Medical Society. Thank you again, Dr. Avery, for all you do for our city and county. And you're on mute, Dr. Avery. Sorry, if you could unmute. We'd love to hear from
you. First time on Zoom, I guess. Thank you. As LCMS president, our board represents over 600 physicians in Lancaster County, and we greatly appreciate the support of the community and the generosity of the community for this. And we look forward to continued collaboration with everyone during this difficult time, and especially as we get back to normal life. Thank you.
Well, thank you so much to you and your colleagues and for all you do to keep our communities safe and healthy. We so appreciate the collaboration that you've had with our Lincoln-Lancaster County Health Department throughout this pandemic and, of course, even preceding that. Now, here with more information about our community's progress in the pandemic is Health Director Pat Lopez.
Thank you, Mayor. Today I want to start off with a vaccine update. As of this afternoon, more than 109,000 people in Lancaster County have received their first doses of the COVID-19 vaccine. This chart that we're showing now shows the percent of the population in each age group that has initiated vaccination. The highest percentage is 79.8 for those ages 65 through 74. The next highest is 76.6% for those 75 through 84 in that age group. For those age 85 and older, 72.6% have had at least one dose. As the mayor said, just over 59,000 people are fully vaccinated, which represents 24% of our county population age 16 and over. We are fortunate to have a high demand for vaccine within our community, and that can impact the rate at which we move through the vaccination phases. Our progress is also impacted by the supply of vaccine and the number of people who we have in the priority groups. Lancaster County, for example, has a higher number of healthcare providers and educators than some other areas of the state. All of these factors mean that Lancaster County may not move through the phases at the same time as other areas of the state. We continue to administer doses received as soon as possible and move through the priority groups as quickly as supply allows. And here are some highlights from our last week's progress. Last week, we vaccinated over 9,000 people at our 2 large-scale clinics at Pinnacle Bank Arena. We had a first dose clinic for those age 59 and up, and a second dose clinic for those residents age 70 and older, as well as educators. We also partnered with Bryan Health and CHI St. Elizabeth to provide first and second dose clinics for residents with serious health conditions. We continue to work with physicians to identify those individuals. In our clinics for this week, we focused on providing second doses for those age 65 and older. Yesterday, we vaccinated about 7,800 people at the arena, and on Thursday, we will be holding another second dose clinic at a new location, the Lancaster Event Center, which is in Northeast Lincoln. We appreciate Amy Dickerson and her team at the Event Center for working with us on getting this clinic site ready. With Speedway Village, we now have 3 sites that are available for large-scale vaccine clinics. We continue to collaborate with the cultural centers and local churches to host some smaller-scale vaccination clinics. These help provide vaccine access to members of our community who have been disproportionately affected by COVID-19. Earlier today, we had a second dose clinic held in collaboration with the Asian Community and Cultural Center. We are planning a first dose clinic Wednesday in partnership with Mount Zion Baptist Church. On April 12th, we will have a clinic at the Center for People in Need in partnership with El Centro de las Americas. Cultural centers and churches are assisting residents with registration for these clinics. We also want to provide an update on the Jnj Vaccine. This week, we also received a shipment of Johnson & Johnson vaccine. As we mentioned at previous briefings, we are partnering with Tabitha to vaccinate homebound adults, and now we will use this Johnson & Johnson vaccine to start this effort. In the near future, we will also start to vaccinate those in certain congregate living facilities, like homeless shelters, residential treatment centers, and the county jail. Next week, I'd like to touch on what's happening for that week. We will be holding a large-scale first dose vaccination clinic for people 55 and older at Pinnacle Bank Arena. We're in the process of contacting those who have registered in that age group to schedule appointments. We will also have 2 large-scale second dose clinics next week as well. It's very important right now that those who have not yet registered for the vaccine do so as soon as possible. The secure online form is available in English and Spanish at covid19.lincoln.ne.gov. Those who do not have online access or who need assistance may call the COVID-19 hotline at 402-441-8006 to register. Our health department also has interpreters available to assist callers who speak other languages. As doses become available, those who are registered will be contacted to schedule an appointment to get vaccinated. The federal retail pharmacy program also has updates. The state announced changes to this program late last week. Nebraskans age 18 and older can now receive COVID-19 vaccine at any participating pharmacy statewide. Lincoln has 3 pharmacies participating in this program: Hy-Vee, Rely Care, and Walmart. The participating pharmacies receive allocations of vaccine from the federal government. Those are in addition to what the health department receives. According to the state, the changes are meant to accelerate vaccination efforts across Nebraska. They will go into effect, they went into effect yesterday as part of the state-directed health measure. Our health department continues to make steady progress in our vaccination efforts. Our department will continue working through the priority phases as we have been. Many of our residents have been waiting for their turn, and we want to honor that. Our goal continues to be getting as many people vaccinated as quickly as possible. We also want to stress again today the importance of continuing to protect yourself and others even after you're fully vaccinated. You can be considered fully vaccinated 2 weeks after receiving either your second dose of Pfizer and Moderna vaccines or your single dose of the Johnson & Johnson vaccine. Being fully vaccinated does allow people to start doing some of the things they have stopped because of the pandemic. According to guidelines from CDC, fully vaccinated people can safely visit with each other. Fully vaccinated people can also safely visit with low-risk unvaccinated people from one household at a time. While being vaccinated greatly reduces your chances of getting sick from COVID-19, you can still be a carrier of the virus. That's why it is critical that all of us continue to take the steps to protect ourselves and others until enough people have been vaccinated. Please continue to wear a mask, wash your distance, and avoid the crowded places, close contacts, and confined spaces when you're in public or if visiting with unvaccinated people from multiple households. Moving on to the risk dial, we continue to see our indicators remain fairly flat, so the dial will remain in the mid-yellow for the 7th week. This indicates a moderate risk of the virus spreading in the community. The real concern is if we were to take a step back and see the resurgence of the virus and the variants. To avoid that and to get to that green level on the dial, we must stay committed to the basic precautions of wearing a mask, watching our distance, and washing our hands to protect ourselves and those around us. We also want to share what our cases look like this week. Over the past 3 weeks, from March 7th through the 27th, the 7th-day rolling average of new weekly cases has been between 43 and 50 cases. If we go back 48 days to February 8th, the average has been in the 40s for 43 of those days. As older adults have been vaccinated, we have been seeing a dramatic reduction in cases in those 65 and older, from about 11% in January down to 3% this last week. Clearly, the vaccinations are making a difference. The flat number of cases means more cases are happening in younger age groups. We have been seeing the largest percentage of increases in residents age 40 to 49 and children 18 and under. This creates two concerns. First, while about 75% of our older adults are vaccinated, 25% are not. So 1 in 4 older adults are not yet protected by vaccination. That adds up to thousands of people in our community. If our middle-aged adults and children contract COVID-19 and spread it to their grandparents and other older adults, we will continue to have hospitalizations and deaths. Second, seeing more cases in younger groups increases the potential for the spread of the variants in our community. Those variants spread faster, get more people sick, and in some cases may cause more serious illness in young adults and children, resulting in increased hospitalizations. Once again, we need to all remain vigilant in wearing our masks and keeping our distance until we get more people vaccinated. We have updated the recovery data on our dashboard, and the definition of recovery has been updated to allow a more efficient recovery reporting process. A person who has tested positive for COVID-19 is defined as a recovery if it has been 60 days from the date the positive lab test was reported to the health department. the person is not hospitalized, and the person has recovered. This replaces the process of calling every person who tested positive for COVID-19 after 28 days. You'll see an increase of about 10,000 on the recovery section of the dashboard due to this change, and because so many people who contracted COVID-19 in November and December and January have now recovered. When we look back at the number of COVID-19 patients hospitalized locally over the past 2 weeks, we've had 20 or fewer patients for 9 of the last 14 days. These are the lowest numbers we have seen since last July. Today, we are reporting 24 hospitalized, with 17 from Lancaster County and 7 from other communities. The positivity rate has also continued to decline. You'll recall that we have moved to a different calculation for the positivity rate a couple of weeks ago using the test over test method, the number of positive tests divided by the total number of tests. In November and December, the test over test weekly positivity rate ranged between 10 to 14%. Since mid-January, when increased testing began at UNL, the rate has stayed below 5%. We have now had 10 consecutive weeks with positivity rates below 5%. And on the left column of this slide, we're showing our indicators when the dial moved into red in early November. We have had over 1,200 new weekly cases and an average of 160 new daily cases. Our local hospitalizations averaged at 100 patients a day. As you move across to the 2 yellow columns, you can see the improvement in our indicators, but also the recent slowing of our progress. The far right column shows data from the week ending March 27th with 347 weekly cases, an average of just under 50 new cases daily, and hospitalizations averaging just under 20 per day. As we get more of our population vaccinated, we hope to see related improvement in our indicators so that we can continue to move forward. Again, thank you to all the members of our community who are doing their part to end the pandemic. Your commitment is the key to our progress.
Thank you, Director Lopez. As our health professionals continue to help prevent the virus from spreading while getting our population vaccinated, we continue to see more assistance flow into our community, assistance that helps our residents and businesses recover from the economic impacts of the pandemic. The American Rescue Plan is now providing funds for our performing arts, which of course adds so much creative energy and a sense of community here at Lincoln. And I know we're all looking forward to being able to go back to the stages, venues, and art spaces that help make Lincoln a vibrant community. In the meantime, we want to make sure that our music and performing arts venues are aware of funds available through the American Rescue Plan. Help is here for our performing arts community. Information is now available regarding the Shuttered Venue Operators Grant Program. This program provides economic relief to live venue operators and promoters, theatrical producers, live performing arts organizations, museum operators, motion picture theater operators, and talent representatives that have suffered from the coronavirus pandemic. Applications will be accepted on a rolling basis beginning April 8th, 2021 through the Small Business Administration. And I encourage all Lincoln venue operators, promoters, and other performing arts organizations to consider getting their applications submitted. Additional information about this program can be found on the Business Resources page of the city's website at covid19.lincoln.ne.gov. We also want to remind residents that help continues to be here for those who need assistance with housing and utility costs due to the pandemic. Lincoln received an additional $13.45 million in federal funds to help individuals and families cover current costs and eliminate past housing and utility debt. We urge those who need help with housing and utility costs due to the pandemic to apply for assistance using the new online form at lincoln.ne.gov/rent. You may also call 402-413-2085 for assistance. More information and the application forms are available at both the lincoln.ne.gov/rent and the resident resource page at our covid19.lincoln.ne.gov websites. Finally, today, we continue to support Lincoln restaurants through the Dine Out Lincoln initiative that we created to help businesses manage lost capacity due to coronavirus restrictions. And working with the health department, we are pleased to be expanding this program and allowing restaurants and other establishments to expand their business footprint into private spaces and or public rights of way. I'm pleased to announce that this program is being extended through August 31st. Those businesses already approved for this program will automatically be renewed and do not need to reapply to reap this benefit. With that, we would be happy to take any questions from the media here today.
Mayor Riley with the Journal-Star with the question for Director Lopez.
She'll be right here, Riley.
Hi, Ryan.
Hi. First question is, to what extent are the new cases the health department's seeing daily reflecting the variants? And is there a delay in whether or not you're able to see it right off, or if it needs further lab confirmation? So to what extent does Lancaster County have, I guess, proliferating variant cases?
Well, through the investigations, we're working with several of the providers to be able to get those tests into the state public health lab. In the sequencing, that's a great question. It does take a while to get the sequencing results back. We do suspect, there's probably more cases, you probably heard that, across the state than we're well aware of because of just the ability to get people tested and get the sequencing done. So we're working very closely with the state epidemiology division and the public health lab to get tests in.
And a question about the dial, Pat. Do you anticipate that, or is the fact that kids are still in school a factor at all in the green zone? And is there any sort of thought given to the moving of the dial based on school?
I'm not sure I understand. We base the risk dial on where it's at for what's happening in the community overall, not just what's happening in the schools. So part of our major concern right now, and I think this has been stated nationally, both by the director of CDC and Dr. Fauci and others, is that the areas that remain flat like we are now seeing an increase in their cases. So what we're really doing is really focusing on getting the vaccine out as quickly as we can to start seeing those numbers pushed down in the lower age groups that are experiencing the positive cases right now in our community, because we've seen the positive impact there's been in those that are fully vaccinated, 75 and older, 70 and older.
Director, this is Brent with Channel 8. Kind of similar along the same lines. At least one Central Nebraska Health District is going to be vaccinating some high school seniors ahead of prom and graduation. Was curious if that's been a consideration here.
Actually, we are considering vaccinating students that are in the appropriate age group, and we're fortunate to have Pfizer vaccine. But we still have, we just started vaccinating those 59 and older this week, and we'll be vaccinating those 55 and older. So part of our main concern right now is just moving through that quickly so we can get to those students. Some of my colleagues across the state are in a different position because of the uptick of those receiving the vaccine. So we're certainly planning on doing that when it's available here.
But not something you'd maybe use the 10% that you're allotted for.
I think what we're more focused is those individuals who have suffered the poorest outcomes from COVID right now, and those with serious underlying health conditions, and those do include students in that age group. And that's who we're focusing on.
And then kind of on the same topic, Councilman Roy Christensen and a couple other city council candidates, they put out a statement today basically calling for all restrictions to be lifted from youth sports, at least when it comes to limiting spectators. Are we at a point where that could happen, and what would be your response to that?
My response would be that we could see that happening when we see a decrease in the number of cases that we're having in the community. And that's not where we're at right at this point in time. Youth sports, they're able to participate. People are able to be present and participate in them. It's just the spectator and the distancing difference.
I think this Thursday would mark 2 months without 100 cases or more being reported in a single day. How much lower, I guess, would it have to get in order for that? And I guess what does that tell you that we've gone that long with relatively lower case counts?
Well, that tells us that we haven't had improvements. We're just treading water right now. We're not going up, which is great, which is what we're trying to prevent, but we're not going down either. And if you look at the age group where the largest percentage of the cases are, it's in those some of those very age groups that you're talking about.
And then my last question, sorry to take up so much time. We're hearing a lot of buzz about vaccine passports and how people might have to show some sort of proof that they've been vaccinated, either to travel or to attend certain events. Is that a consideration locally?
That's something that the state's been looking into, and I've been just following along with the information they're receiving. And nationally, it's all still really under development, Brent, but we'll certainly keep you appraised of what we learned that's changing and when some actual decisions have been made.
Thank you.
This is Bill. Follow up on the risk dial questions. While cases have remained stagnant, it seems serious cases have dropped pretty significantly. Hospitalizations have dropped about 50% while we've been in mid-yellow. Deaths have dropped significantly since January and February. What kind of a role does that play in determining, when to move the risk dial to low yellow or even green, or contemplate removing the mask mandate?
All of that, it's taken into account, but it's the whole picture. And it's the fact that while we have reduced hospitalizations, and part of that's because we've had the monoclonal antibodies to administer quickly when we have those in the older age categories that become positive, or people with serious underlying health conditions. Part of it's because we have been working hard to vaccinate those with serious health conditions, working with our physicians and our hospital partners in Lincoln Surgical Center. And then part of that also is as we continue to move through the age groupings, we can't just look at hospitalizations only. That's never been the only measure that we've looked at. While we're really happy about that improvement, we see it still as something that we have to watch carefully, and we really need to see a decrease in cases overall, Bill. We've been in the same place now for a long period of time, and that's what the concern is.
In talking about, vaccinations, a majority of health districts are now in, 18 plus, vaccinate whoever wants to come in. Initially the state distributed vaccines based on population. Is there a push from you to the state to maybe give some of these higher population areas more of a concentration than you have been getting?
That's almost a conversation I have daily, to ask for more vaccination. And I know this comes up frequently. Not every health district was at the place to open up to 18 and older. And I do need to say that. That is not representative of our whole state. It certainly wasn't representative of Douglas County or Sarpy, Cass County. It wasn't representative of my fellow health department, Four Corners. But in some areas of the state it was. And sometimes we're asked about how we move forward, and I just want to give an example. In Omaha, combined between the federal pharmacy program that provides vaccine and the local health district, they received 30,000 doses. We received, combined with our federal pharmacy programs in Lincoln and our allocation, a little over 12,000 doses. And while our population is different, I think it just points out that, you know, we have people knocking on the door to get vaccinated here, and we're doing everything we can to have that happen. And yes, I have talked to the Department of Health and Human Services about this and seen, and I think hopefully they'll be able to look at some other options for us here. We've had a great response, and you can see by the people who are getting their second doses, we've had a tremendous response of people getting the first and the second doses. And that's going to help our community to move to where we need to be to have herd immunity.
Does the doses given out via the federal retail pharmacy program, are those reflected on our dashboard?
No. But we do reflect the doses given in the community bill, if that's what you're asking. And we have to remember those are second doses for them, like for us.
So those, not only what's distributed by the health department, but also what's distributed by local pharmacies, all of that data is on the dashboard.
Yeah.
Okay.
Sorry, Bill, I misunderstood what you were asking. Yes, we go to the state registry system and pull our data and then do a comparison with what we administer here.
Thank you, Matt.
Uh-huh.
Okay. Any further questions from the media? Well, if not, then in closing, I just want to say thank you once again to Dr. Avery for joining us, and happy National Doctors Day to all of you and to all the physicians who've been helping to keep our community healthy. Thank you to everyone who's stepping up and getting vaccinated. Together we can and we will defeat this virus and reinvigorate our local economy. Thank you. Thanks, Margie.